Okay, so what we need to do first before we actually get started to the injection is that we need to have and acknowledge the different safety injection, just to make sure that everything is for the protocol. So what I'm going to do, I'm just going to double check Mr. Mario Mancini's MAR just with the order, just to confirm that everything is, there's no mistakes or anything like that. So I'm just going to confirm in this situation that Mr. Mancini does not have an armband, but you would check his armband just for his number and his name as well. So it was Mario Mancini. I'm also going to check the MAR just to double check that the medication is correct with the doses and the frequency of time. So basically we have, first medication is heparin. Heparin is going to be given 5,000 units per 1 milliliter, and it's going to be given subcutaneously. So I checked with the MAR and with the charts as well. I can see that there is heparin, 5,000 units, and it's going to be given subcutaneously every 12 hours, and it is 5,000 units per 1 milliliter, as I can see right here. For the haloperidol, the dose, I calculated it, and after doing the calculations, I got a 0.5 milligrams per the 1 milliliter, and that's going to be intramuscular. And I checked back to here, haloperidol, intramuscular, and with the same dose, so that is good. Every 4 hours, and it's a PRN medication, and I can check over here every 4 hours in PRN. And administration time is going to be given at 7 o'clock today, and it's going to be given by myself. And in order to ensure that the injection routine is going to be satisfied and safe, we need to go over the 8 rights. So we do the right of the patient, right medication, right dose, right frequency and time, right reason, right documentation, right site, and right route. So now we can actually start with the whole procedure. Okay, so before we actually start with the medications, with the injections, we just need to do a full body assessment of the Mr. Mancini before we actually start to administer the medication and the injection. So one thing that we need to indicate is that for a bigger individual, they have more body mass, so it may be a lot easier to use a thicker needle with a larger gauge with the barrel. But with Mr. Mancini's case, he is more thinner, so therefore we can just use a normal size needle and gauge that is appropriate for the intramuscular injection and the subcutaneous. So, but in another indication, if he was much larger, we would just have to use a thicker needle just so it can penetrate more easily for the medication. Okay, so we need to indicate whether we need to use a larger needle, a smaller needle, in our barrel size with intramuscular and subcutaneous injections. So for subcutaneous, you're going to be using a smaller needle, and the subcutaneous size is going to be around 0.38 to 0.63 inches. And as the gauge, it's going to be around 25 to 27, just because subcutaneous, you're going to be injecting it in a more fattier area. And for intramuscular, you're going to be using a larger needle and with a smaller barrel, and the gauge is going to be around 20 to 25, whereas the needle is going to be 1 to 1.5 inches. Use a longer needle just because you're actually penetrating through muscle, just ensuring that you're getting the medication through all the way. We need to perform a hand hygiene. So just in this case, we're just going to do a quick hand rubbing with with the sanitizer and the alcoholic rub, just making sure we are all ready and hand hygiene is performed. Okay, so now we can actually start prepping the syringes and the needles for the subcutaneous and the intramuscular injections. First one I'm going to prepare is the intramuscular. So what you want to do before you actually bring back medication is that you want to put 0.5 milliliters of air just into the medication, just to kind of release that, and we can prep it. So I'm just going to have 0.5 just for this one. Next, you're going to be putting the cap, which has the needle inside, just attaching it to the actual syringe, just to make sure. Give it a nice twist until it's fully on like this. Now I'm just going to prepare the subcutaneous needle. So I'm just going to put 0.5 milliliters of air so that I can just insert and inject that into the medication. So I'm going to pull the 0.5. So now I've just inserted 0.5 milliliters of air so that I can just insert it into the medication. Now I'm just going to put the the needle with the cap on it so that I can prepare that. So just a twist on there. And then now it's fully on. So what I'm going to do next, I'm going to take the heparin, and I'm going to take the haloperidol. So this is going to be the haloperidol medication for the intramuscular, and then the heparin for the subcutaneous. So what I'm going to do first, I'm just going to take an alcohol wipe, and I'm just going to wipe it down for approximately 10 seconds just to make sure that the site is clean. So I would do this for approximately just 10 seconds. Okay. Okay, so I'm going to be doing the intramuscular medication first. So I'm just going to take the cap off, like so. And then I'm just going to insert the 0.5 milliliters of air first. After I insert the air, I'm going to draw the 1 milliliter of medication for the heparin. Okay, so I'm just going to stick it in. I'm going to insert the air. And after inserting the air, I'm just going to flip it and then start drawing out the medication. I just want to ensure that I'm not getting any air bubbles in here. Okay, so I have the 1 milliliter. I'm just going to draw just a little more, just because to push out, just to get all the air bubbles out and if there's any leakage. So I'm just going to get a little bit more. Okay, I'm going to pull it out, and I just want to flick it just to get any air bubbles, just any slight air bubbles out. So after I do this, just for safety and precautions, I'm just going to put the cap on, and then I can get started on my subcutaneous injection and get that started. So I'm going to take the subcutaneous. Okay, so next I'm just going to start with my subcutaneous one. So I'm just going to take off the cap, and what I'm going to be doing, I'm just going to be putting the 0.5 milliliters of air in first, and then I'm going to draw the 1 milliliters, which is the dose for Mr. Mancini. So I'm going to stick it in. I'm going to give the air inside, and I'm just going to draw the 1 milliliters now. I just want to make sure I'm not getting any air bubbles in. Okay, and I'm just going to be giving a little more just because I'm going to be trying to get rid of the air bubbles. Okay. Okay, and what am I going to be doing? I'm just going to give it a quick flick just to get any air bubbles out. Okay, now I'm just going to be putting the cap back on just for safety and precautions. Okay, now what I'm going to be doing, I'm just going to be making sure that for identification purposes and for safety measures, just going to be taking a piece of tape for each medication, and I'm going to be writing the name, the drug, and the dose just around that. So what I'm going to be doing first, I'm going to be doing the heparin, which is the subcutaneous. So what I would do, I'm going to write Mr. Mancini, his name first. I'm then going to be writing the actual drug, so it is the heparin. Okay, and then I'm going to be giving, I'm just going to write the subcutaneous just on there. And then I'm going to be writing the dose, 5,000 units per the 1 milliliter. So now I have this, I'm going to put it on the cap of the needle, just to make sure it is a proper identification. And for other health members, just to be aware of the type of medication that Mr. Mancini got. I'm going to do the same thing for the intramuscular as well. I'm going to be writing his full name. So Mancini Mario. I'm going to be writing the actual drug name. So that is going to be the haloperidol. And this one is going to be given intramuscular. So I'm just going to write that down for identification. And then I'm just going to be writing the dose, which is the 0.5 milliliters per 1 milligram, sorry. So now I can take it. What I'm going to do, I'm going to do the same as I did for the subcutaneous one. I'm just going to put it around the cap for identification. Okay, so now we can actually get started with the injection. So I'm just going to perform the proper hand hygiene once again, just using the alcohol rub. And after using the alcohol rub, I'm just going to be putting some gloves on. All right. All right, so I'm also going to confirm once again Mr. Mancini's identification and how I would be doing this. I would always check the armband just in this setting. He doesn't have an armband with him, but I would check his full name, Mario Mancini, with his number as well. Also need to be indicative of any allergies Mr. Mancini has, and through looking at the lab values and what he has told me, he has an allergy of codeine, so it's something we need to take in precaution, be aware of. I'm just going to be, after explaining, I'm just going to be giving a full introduction of myself and the medication and the procedure, what I'm going to be doing. So hello, Mr. Mancini. I'm Alexandra Marcus. I'm a level 2 nursing student with McMaster University. Today what we're going to be doing, we're going to be giving you 2 injections, subcutaneous injection and an intramuscular injection. First thing that we're going to be giving you is a subcutaneous injection in your abdomen. And it is the heparin anticoagulant drug. So what I want to do first, before I actually get with the injection process, I just want to palpate and inspect the area just to see if there's any bruises, lesions, any tenderness or masses that I need to be aware of. So I'm just going to feel with the abdomen just around, just with the light palpation, just to identify if Mr. Mancini is having any pain, any bruising, any lesions. But from the site and inspection and palpation, everything looks normal and within his limits. So that is normal. So now what I'm going to be doing, also with the subcutaneous, you want to be giving it at a 45-degree angle just to ensure that the medication is going through properly and reducing the amount of pain you're going to be giving for Mr. Mancini. So we're going to be doing that first. So what I'm going to be doing, I'm going to be cleaning the area, and usually you would do it around 30 seconds, but just for this case, I'm just going to do just a nice clean. But you would, in a real clinical setting, you would do it for approximately 30 seconds just to ensure the site is clean. So I'm just going to be doing it on just this side of the abdomen because it is the fattier area for a subcutaneous. So I'm just going to wipe it down for approximately 30 seconds. In a real clinical setting you would. So as I'm wiping it down, okay, so I'm just going to discard the alcohol wipe. So next what I'm going to be doing, I'm going to be giving the heparin, which is the subcutaneous medication. So what I'm going to be doing, you want to make this as quick as possible but effective so that the patient's not in a lot of pain. So I'm just going to be taking the cap off. And Mr. Mancini, I'm just going to be giving you your heparin injection now. I'm going to be doing it in your abdomen, okay? So just informing the patient. Okay, so I'm going to be going 1, 2, 3. Okay. And I'm just going to push the medication in. There we go. Once that's done, you want to take it out. And once you do this, you always want to put the cap back on, and then you always want to discard them in the sharp spin. So that's what we would be doing. So what you want to do after the injection, you would use the proper, like a cotton ball or a proper adhesion methods just to ensure that it's comfortable and no leakage or anything is coming through. So I'm just going to take some tape as well, and I'm going to put it onto the injection site. And usually you would put maybe a cotton ball or something like a softer material just to provide the comfort. Okay. So now I'm going to be giving the intramuscular injection. So what I'm going to be doing first before the injection, I'm just going to clean the area for approximately 30 seconds that you would do it in a real clinical setting. So just going to make sure everything is clean around it with these alcohol wipes. In a real clinical setting, you would do this for approximately 30 seconds. Okay. So now we can get with the injection. Now, Mr. Mancini, we just completed your subcutaneous injection. I'm going to be giving an intramuscular injection of haloperidol on your deltoid, which is the muscle on your shoulder. So what you also want to do you also want to inspect and palpate the area. So just looking once again for any masses or tenderness or any lesions or anything that's going to be painful around the area. Just palpating, and you're also inspecting as well, seeing any facial expressions indicating any pain. So overall, everything looks within his limits, so everything looks normal here. So what I'm going to be doing now, I'm going to be giving his intramuscular injection. So just very similar like the subcutaneous. I have my needle right here. Identification is complete. Always informing the patient. So Mr. Mancini, I'm going to be giving your haloperidol. This is known as a mood stabilizer. So I'm just going to be giving it into your right deltoid, okay? So I'm going to take the cap off. Okay. You want to make this as fast but efficient as possible, just to reduce the pain in the patient. So I'm taking the needle. Okay, Mr. Mancini, I'm going to be giving your injection. I'm going to count to 3. 1, 2, 3. So I'm going to insert it, and then I'm just going to release the medication inside. Once that's done, hold the skin, pull it out. What you want to do after, you want to put the cap back on, and then like for the subcutaneous, you're going to put it in the sharp spin. I'm also going to usually you would put a cotton ball or something much softer underneath the tape just to cover the incision area. All right. So I would just put it on the arm, just like right here. Okay. Okay, so after doing the injection, what we need to do is documentation. So with documentation, I need to get rid of the mess and the garbage. So the needles and the syringes you get rid of in the sharps bin, but that's just kind of garbage you want to throw out. So now I'm going to actually document the injections. So what you want to do, you want to write the admission time, the date, your name, and your position. So in this kind of case, because I am a nursing student, it was given, both the subcutaneous and intramuscular were given at 7 o'clock, and my initials are AM, so I'm going to write that for both times. And I'm also going to write today's date, which is February 4th. So I'm going to write that down. February 4th on a Monday, 2019. Monday, February 4th. And then I'm just going to write my position on the back. Once again, my full name, just indicating that you have given the medication. I'm a level 2 McMaster nursing student. And after I have fully documented that I've given Mr. Mancini his medication with the time, date, and my position, I'm going to now do the proper hand hygiene technique. I'm going to get rid of my gloves. I'm going to use the hand rubbing technique. And thank you, Mr. Mancini. I hope you have a great day.